Good evening, I'm David Ferris and welcome to this week's edition of the Chamber Buzz. We have a special treat in store for you. We have three doctors, Dr. Rose Glenn, Dr. Edward Kim, and Dr. Matt Pazak, and they're here to introduce all of us to robotics and surgery. Tonight's show, as always, is brought to you by the good folks at Roger G. Taylor and Associates, who want to help us look around Rocky Mount and see what's going on this week.
Y'all, Julia, you want us to look at you?
Yeah, I'm gonna figure this one out. Right here.
Come on now, I can't hold my stomach in too long.
Sucking tuck-in. Let's see, that was a trial run. Say, Prime Smokehouse.
Prime Smokehouse.
Thank you.
Supposed to take a picture about.
Good morning. I'm David Combs, Mayor of Rocky Mount, and we're downtown in the Douglas Block in our newest business in downtown Rocky Mount, the Prime Smokehouse here, and we've got the owners here, Yalom and Ed Wiley and Beverly Ringer. They're down here together, and I don't know how many of you have been down to the Douglas Block lately, continuing to have new tenants, and I've been here, I've eaten here. The food is absolutely wonderful. When you talk about brisket and you talk about pork, this is a great place to come eat. Everybody that I know of has had great meals down here, had nothing but wonderful things to say about the business. But on behalf of the city of Rocky Mount and our city manager standing right here behind us, and this has certainly been a big initiative for Rocky Mount, is not only to redevelop downtown, but also have a key restaurant in downtown Rocky Mount, and y'all have done that and done it extremely well. But so on behalf of the city of Rocky Mount, I want to present you with this. It just says City of Rocky Mount, North Carolina, presented to Prime Smokehouse on the occasion of your ribbon cutting and grand opening with sincere best wishes, and we hope you have the best of luck down here, and if you continue like you have been doing and the food continues to stay like it is, I don't think you're going to have any problem at all. So it's we're glad to have you in downtown Rocky Mount. Congratulations and best of luck to you. And I'm going to let Sherlyn speak on behalf of the chamber.
Thank you very much, and it's my honor. I'll be the first to say I think this is my 5th time down here, and I'm going to have lunch in just a second. I've had takeouts, I've eaten in, and it's absolutely wonderful. It's great to have this, and it's great to have you downtown, and there's nothing I want more to see Rocky Mount's downtown grow and have more businesses like this and very successful businesses, and we wish you all the very best, and thank you. That's all I can say is just thank you very much.
I do see Mary Wells over here, a county commissioner. We're glad that she's here with us today. And I'm going to see if Ed or Yalom want to say anything. But there's a long history here with this restaurant and probably some of the recipes that they use. And I'm just going to let y'all tell us a little bit about the restaurant and how you ended up coming to Rocky Mount.
Well, first of all, thank you very much. I mean, we can't express our gratitude enough for the way we've been welcomed and received here in Rocky Mount. It was us in Raleigh, North Carolina, running the same kind of a restaurant. And a lot of people from Rocky Mount would come up from weekend to weekend, and they'd say, you know, we need one of these in Raleigh, in Rocky Mount, excuse me. We need one of these in Rocky Mount. And we were invited to come down, take a look at the city, see what they were doing, and we were astonished at just how much energy and effort had been put into redeveloping the downtown area. And guess what? We wanted to be a part of it. Initially, we thought we'd have a place in Raleigh and one in Rocky Mount, and we came here and we got so caught up into the whole process of the thing, we said, you know what, let's pack our bags, hang our shingle on Rocky Mountain, call it a day. And we haven't looked back since. We're very thankful. We appreciate it. We thank you for your prayers, your support, your patience, and all those sorts of things. So I just wanted to give it back to you and say thank you for receiving us as well as you have, and we appreciate that.
Now, let me ask you something.
Yes, sir.
You doing not only the meals here, but you have entertainment and that type of thing. So why don't you talk about that a
Yes.
little bit?
You know, as many of you know, my father was a very well-known jazz musician, Ed Wiley Jr. He was also a fabulous cook. And the thing that he really was good at was digging a deep hole in the backyard, slow smoking beef briskets and spare ribs and all kinds of things. And he'd have a jam session right there in the yard. And it would be, and this was growing up outside of Philadelphia. We'd pick all these wonderful fruits that grew in the backwoods in our house. People say woods in Philadelphia, but yeah, there was woods there. We picked all of these fruits, and my father could turn anything into a delicious pie. And so the tradition continues here, you know, and not just with the food and the wonderful dishes that he cooked, but also his tradition in music. And unfortunately, I lost him a couple years ago, but his spirit lives strong here. And one of the mainstays of what we're doing here now will be the live music. And the third week of July, we'll kick off our weekend dinner jazz series every Friday and Saturday night, 9 o'clock. We'll do 2 shows. So for those folks who don't turn into, you know, wrapping a cocoon after 9 o'clock, you want to come out and enjoy that. And, you know, we bring different groups from all over the country. And the good thing is that we even find some right here in North Carolina, Eastern North Carolina, to sort of buttress the sort of national compilation of musicians that we bring through. So we're really grateful for that. We're in a hotbed of good music, the home of Thelonious Monk and Harold Vick and a lot of the great musicians who come from this region and who've come through this region or who are from this region. So we're very thankful. We think that this place really presents a broad opportunity as far as music, good food, and all those things that are happening. And one of the things that when we first started in Garner, North Carolina, in 2008, when we first kicked this thing off, the one thing that people really appreciated about our restaurant was that it was a place where different people came together. And it crosses age barriers and race barriers and all those sorts of things, and just people come together, have a good time, because everybody wants the same thing. They want a clean environment, they want a safe environment, they want to eat good food, and they want to click their finger to some good music. We all want the same thing. So, and this place presents such an opportunity, and we're very, very grateful for it. I know somebody else has to say something besides me, though.
That's fun. So thank you so much for having us here in Rocky Mount. We really appreciate it, like you said, and we're looking forward to kicking off the music, and hopefully the coffee shop is going to be a big part of this thing that we're doing, and we're going to try to get that up and running in the next couple of weeks, and Yalam's going to be the head of that. And so we've got good things to come, and we really appreciate being here. And thank you.
Thank you again for joining us this evening, and we are going to talk about robotic surgery, which is something, when I was growing up, out of science fiction, I guess, but it is here, and Rocky Mount seems to really be on the cutting edge of it. Dr. Gwen, tell us, our audience, what you have.
These are the 2 instruments, some of the instruments that we use with they're actually attached to the robotic arms, and it's like an extension of our arm. And this one is the small scissors. They're a monopolar instrument, so it delivers the cautery, which is like a burning device, at the tip, not along the shaft here. And the bipolar device is like a grasper, and it delivers cautery, which is a way to stop bleeding or hold vessels and stop them from bleeding by delivering the voltage or the heat between the little graspers here. So only this part between the graspers is hot, and only at the tip is this hot, not along the shaft. So it's protected by these sheaths. On here is, on the back side, there are 4 little wheels, and the wheels allow us to turn the instrument. It allows us to open and close its arms, So basically it's like an extension of your hand, and your hand can go in all different directions, and the same thing with this. That's a good thing in surgery because it allows us to get into very small places. It allows us to do very, very intricate dissection under a microscope, so it allows us to better visualize what we're doing. We can control bleeding, and damage to other organs is minimalized because of the small instrumentation, and less risk of damage because we're actually controlling it ourselves as we're doing the surgery.
When Dr. Pazak, your parents and I, you know, computers weren't even, I'm not sure they were in the dictionary then, I'm sure they were. When you were trained in med school, was this part of it already?
So the robotic technology is an extension of the laparoscopic technology,
Right.
which is, for lack of a better word, is video surgery, where we stand outside the patient and the video shows us what we're doing on the inside. And I kind of explain it to my mom when she asks me about this. I tell her that I take my fingers and I use the instruments as pinchers, and that's the best way to explain it. It corrects for any errors that I make, and while I still control it, it certainly makes things a lot easier. It's certainly, working down in the pelvis like Dr. Glenn and I do, it comes in quite handy because you can get to places a lot easier that you wouldn't have such easy access to through an open incision.
And less invasive, so I would think the recovery
Correct.
time would be much shorter.
Mm.
What types of, what's the advantage in using that with, in your case, with women, and who qualifies? How do you determine if somebody's qualified or not a good candidate for it?
Any of the GYN procedures, hysterectomies, certainly our oncology patients, the patients with endometriosis, patients who've had prior surgery, the patients that, actually even obese patients, because those are very difficult to do, open procedures. Pretty much any of the surgeries that you would normally perform, first you try to decide can it be done in another manner, like vaginally or just laparoscopically. But if there's something in the history or the actual disease process that makes it better instrumentation to use the robotic procedure, that's what we use. So any of the GYN surgeries are applicable to this.
That's amazing.
It is, actually.
That is. That's just
Yep.
incredible.
For recovery time for women, that's one of the biggest advantages. In days gone by, 5-10 years ago, if we did an open procedure, it would take them 6 to 10 weeks to get back to work, to be able to do all their activities of daily living, lifting heavy objects greater than 40 pounds. Now, most of these women are back to work and doing things within 2 weeks.
Within 2 weeks.
Within 2 weeks. So
That's
it's
amazing.
It's quite a difference in
Goodness
speed
gracious,
of
it
recovery.
is.
Still big surgery, but smaller incisions.
Right.
Makes a difference.
It does.
That's and flip that back over just a second, and that connects to basically robotic arms or something that I would relate to like that.
Yes. What happens is the robot, the instrumentation stands by the bedside, the robot itself. After we make the small incisions, we place these through, they're called trocars, so they are inside the abdomen, in my case. And then these are positioned on the robotic arms, and they slide into the trocar, into the abdomen. Then the surgeon leaves the bedside and actually goes to the console and sits down like a video game in a sense, and we control the arms from our fingers.
So you're not actually over the patient
No.
like days past,
Right.
but a short period of time.
There's still an assistant at the patient, but the primary surgeon is at the console.
That's just
It allows us kind of better control of the whole surgical field. I think one of the major advantages in my surgery, laparoscopically, when we did hysterectomies, one of the difficult things was your assistant had the control of the camera for you to assist in the surgery. Sometimes, if it's a longer surgery, it gets tired. It's very difficult. Could you turn it here, move it here, move it here? Now I can actually move the camera into position, and it's locked in place. I don't have to rely on another individual to help me So it gives me better access to the tissue that I need to see.
Time-wise, the surgical procedure now, from prep to moving them into recovery, has it reduced that time much?
In the beginning, when you first start, as in any procedure, there's a learning curve.
Sure.
And when you first begin, probably your first hysterectomy, depending on your experience from school and residency, could take you as long as 5 to 6 hours. After you pick up in terms of volume and the number of cases you do, and you become more regimented in how you do each procedure, so it's reproducible, you do things a certain way, I would say that probably I'm averaging 35 to 40 minutes, which is far less than when I first started. So it's now probably as quick as I would have done an open procedure or a straight laparoscopic procedure. I can either do this at the same amount of time or even less, depending on the particular surgery I'm doing.
That's incredible. That's incredible. Well, Dr. Glenn, thank you for showing us that. And when we return, we'll have Dr. Edward Kim join us. Dr. Kim, thank you for joining us in the second segment. And Dr. Pazak, thank you for standing up under the lights.
Yeah, my pleasure.
We're glad to have both of y'all here. Continuing on with robotic surgery, what are other procedures that are fairly common now? What are y'all doing with it?
Sure. So in urology, which was fairly early in the robotic curve, the marketers at Da Vinci did a good job getting involved with the with the urologic surgeons. Prostatectomy has become probably the main use of the Da Vinci robot. We're now partial nephrectomy, where we take a small tumor off a kidney and kind of leave the rest of the kidney behind, where 10 years ago, if you had a small tumor on your kidney, we took the whole kidney. Well, we've learned through the years that maybe leaving the rest of the kidney that didn't have the cancer on it was beneficial to the patient, and the robot certainly makes it a lot easier for us to accomplish this. So between the prostates for cancer coming out and kidney tumors coming out, those are the main things we're doing at Rocky Mount Urology.
That's amazing. I'm just really in awe over all of this. Dr. Kim, got a gallbladder problem. Thankfully I don't, but I do. Yeah. And I'm in your office, or I'm under the bright lights that aren't these.
Well, I offer either laparoscopic or robotic gallbladder surgery.
Why one over the other?
Well, I think each case has their own advantages. Sort of what Dr. Glenn mentioned, the robotic arms gives me distinct advantages in terms of articulation of the instruments. It allows me to bend and articulate the instruments that I can't do with typical laparoscopic technique. In addition, the trocars, the instruments that we use to enter into the abdomen, have fixed points. So in theory, the patient has less pain from those. Typically we humans are kind of push and pull in. We don't really stay on a fixed axis, and the robot knows better to violate that axis. So it's just constantly moving on that same tilt. One thing I am starting to offer is what we call single-site gallbladder surgery, and that's what I'm really interested in at this point. Typically when we do laparoscopic gallbladders, we make 4 incisions. The newer technique that's becoming more and more popular is what they call robotic single-site, and that's actually we make 1 incision. It's usually only about 2 centimeters. It goes directly through the stomach or the belly button, and we are able to remove your gallbladder through that tiny incision. And once the incision heals, it's almost scarless because no one really looks at their belly button, and no one really can see a scar on their belly button. So that's what's really exciting to me in terms of robotic surgery, taking your gallbladder out through a single incision.
Dr. Glenn had talked about the recovery on the old days of hysterectomy being, 8-10 weeks sometimes, and how it has shortened that window. Gallbladder used to be, 30, 45 days sometimes?
Typically when I do an open gallbladder, I tell them out of work, no heavy lifting for about a month to up to 6 weeks. Nowadays, with standard laparoscopic surgery, I actually send them home the same day, and I typically tell them their activities as tolerated. They can pretty much do what they want. I've had some people go back to work the next day. I've had some people go back to work after a week to 2 weeks, but by and large, they go back to work after 1 week, almost all by 2 weeks. And it's the same thing with robotic surgery. It's just an extension of laparoscopic, typical laparoscopic surgery. In terms of the single site, the incision is a little bit bigger than your typical trocar, so they're typically going to probably be out of work for about a week to 2 weeks.
But no more than a month.
No more than a month.
6 weeks.
And they go home the same day. They're not in the hospital 2, 3, 4, 5 days, which is typical for the open gallbladder surgery.
Kind of jump to another point. How does this affect the hospital when the facilities are built there, with so many beds, anticipating so many nights, and you've certainly shortened that cycle, thankfully.
Yeah.
From my experience being here for now almost 2 years, Nash General Hospital is never not full.
Okay.
So certainly, the sooner you can get a post-operative patient out, the better. I'm not a hospital administrator. I can't speak to the finances. I do know it's an expensive machine, and I don't know where your break-even versus profitability points are.
I think from the discharge standpoint, the hospitals, they really like it.
Yeah,
I remember when I first got here 5 years ago, and I sent all my gallbladder surgeries, my laparoscopic home the same day. The hospital was like, wow, really? And they really caught on to that because they don't have to, I think overall it's better for the patient. They're more comfortable at home, but it's also economically good for the hospital as well. So they really like that. Any type of laparoscopic surgery or robotic surgery with a short recovery time is important to the patient, important to the hospital. The patient is able to go back to work, start their normal daily activities. All that's very important.
Are you getting many out-of-town patients because of this, or is this getting to be more the norm in other communities?
Well, from a general surgery standpoint, there's really not many general surgeons in this area doing any. I think the closest is Raleigh. Besides that, it's in Whitehead, North Carolina, which is in Fayetteville, maybe in New Bern. But there's none in Greenville, there's none in Wilson, Roanoke Rapids, Halifax. There's no general surgeon doing robotic surgery.
So if I need to have that procedure, if I need to go see you tomorrow, I don't have to go to Raleigh.
Correct.
That's wonderful. It'd be easier on the patient, I would think, and certainly easier on the family. That would be, that's great, cutting edge. I like that. Of course, there's so many things going on out at Nash now. It's just incredible, and Boice Willis is such a tremendous asset to the community as well. It's the whole medical family in Rocky Mount, Nash County makes a huge impact on the quality of our life, and it sounds like with what you are doing, it's just getting better and less painful each and every day. I want to thank you, doctors, for taking time out of your schedule to join us this evening. I know it's a sacrifice, and I hope our audience enjoyed it and got as much out of it as I do. I think this is a real step in great medical care that we don't have to go outside of our community for. And thank y'all for joining us, and gentlemen, thank you for coming in again.
Thank you for having us.